State inspectors found trays of blood-caked surgical tools at the University of Colorado Hospital.
There would be lots of blood on those instruments, and the longer they sit and the blood dries on the instruments, the harder they are to get them cleaned.
They were so short-staffed that they were basically putting all these things to the side saying, we'll get to it at some point. And then eventually they just stacked up and they ran out of the instruments that they could use.
Short staffing obviously is a problem right now in dentistry.
You know, I've always had just one goal for Dental Assistant Nation, and that was to reach as many dental assistants around the world as I possibly could. So thank you for being a part of the community. And I want to make sure that you have hit the subscribe button so that you can not only help us spread the message and we can grow our reach, but also to make sure that you are getting the latest episodes delivered right to you the moment that we drop them. We are all about dental assistant education and empowerment here at Dental Assistant Nation, and we want to make sure that we are reaching as many dental assistants as possible. So thank you in advance, not only for being a part of this community, but for helping us spread the word. Hey everybody, welcome back into another edition of the Dental Assistant Nation podcast. My name is Kevin Henry, founder of Dental Assistant Nation. So glad you've joined us for another episode. I want to make sure you're subscribed to us on YouTube. And if you like what you hear today, hey, give us that like on YouTube or those 5 stars on whatever podcast platform you are using, because I know you're going to like what we're talking about today, because I have on an amazing dear friend of mine and one of those trusted voices in the industry, and that is Mary Govoni, CDA, RDH. Hey, Mary, how are you, my friend?
I am great, Kevin. Glad to be here again with you. We always seem to have lots of things to talk about.
You know, and it's funny. It's like this time of year, we kind of get drawn toward each other whenever we start to get into the respiratory illness time of the year and what we need to be talking about and everything else. And I know we're going to chat about that in a few minutes, but you know, I sent something to you, and you were the very first person I thought of whenever I saw this. I live in Colorado, and I've subscribed to the Denver Post, our local newspaper, because yes, I still believe journalism is important. But the headline of this: state inspectors found trays of blood-caked surgical tools at the University of Colorado Hospital. And, you know, just diving into it just for a second here, they were so short-staffed that they were basically putting all these things to the side saying, we'll get to it at some point. And then eventually they just stacked up and they ran out of the instruments that they could use. Mary, is this a warning to us in the dental industry? And what did you see in this?
Oh, well, I saw so many things, and thank you for bringing that one to my attention. Yes. Short staffing obviously is a problem right now in dentistry. And even when we didn't have such a staffing problem, I would see a lot of times going into offices, see instruments stacked up. Obviously worse in a surgical center because there would be lots of blood on those instruments. And the longer they sit and the blood dries on the instruments, the harder they are to get them clean. Appeared to be, in all the information I read about it, lack of training about appropriate cleaning of the instruments. We just clean like one side of a hinged instrument and not the opposite side. And people not re-cleaning or reprocessing items that didn't get through the cleaning process. So yeah, they had to cancel all their patients for periods of time. I cannot imagine what that would be like in a dental practice. The bad publicity for a dental practice could literally shut it down permanently. I mean, who would go there? I mean, that takes me back to the incident that happened in Oklahoma about at least 10 years ago now with the oral surgeon. So yeah, short staffing is a big issue. And also now when we see so many dental assistants coming in to the profession without training, without prior experience, if they don't get some thorough training, especially in instrument processing, they're just kind of thrown to the wolves. And it makes me think back to a story that our dear friend John Molinari always told me. He wanted to buy the rights to the story. And you've heard this one before, in a practice where a young lady was hired in to be the sterilization technician in this practice, and she was kind of thrown to the wolves, didn't remember a lot from her training. But one thing she remembered was you never put the instruments away without seeing the black lines on the tape. So they were using clear pouches and heat sealing them and then sealing them with autoclave tape. And she cleaned them up, packaged them, put them in the sterilizer, and when she couldn't remember how to use the sterilizer, she took them back out. She drew the lines on with a Sharpie and a ruler so that they looked like they had been processed. And it was a day or so before somebody figured out that, hey, something's wrong here. And that was right in the middle of the HIV epidemic too. So you just cannot imagine the horror of that whole thing. So something that practices need to remember is that you cannot just hire someone, even someone with experience. And I always say, you hire them on a Friday and they start on Monday. You can't do that, even though you want to, because they've got to go through some onboarding. They've got to go through some orientation and understand how your equipment works, what's your process, and fundamental information. And if people don't have access to basic infection control training, the CDC's got a ton of it. It's still there, it's still accessible, and it's free. So it's a great resource for these practices. But yeah, it's kind of the wild, wild west out there right now. And if patients are walking past a sterilization area and they see, it's kind of like walking into a kitchen where you see all the dishes stacked up. You think, well, she's not a very good housekeeper. And the patients are probably thinking the same thing. What's going on here if we can't keep up with that process?
A friend of mine has a saying that you never want to know how the sausage is made. And I agree with that completely on so many levels as a lover of sausage. But hey, it's exactly right because one thing that I have seen so often is that dental practices will do the tours for patients and they'll show them the sterilization area and talk about the high levels that they go to keep patients safe. And I know a lot of practices do that, but I also wonder, are we kind of just saying those words and we're not actually doing the right things to follow up on them?
I have told practices for a long time to do that if they want to see what's going on. But I've also told practices, stop it until you clean it up. I mean, if you've got clutter and the sterilization area seems to be the collector of all the clutter, and if you've got countertops that have delaminated and you've got exposed fiberboard underneath no, we don't want to show that to the patients. And I get it. There's not maybe a lot of money in the budget to do a bunch of remodeling, but do something temporary to make it look better. But don't show the patients those areas if it doesn't look neat and clean. And you have to put yourself in the patient's place that if I am the patient, what are my expectations? And if I see something that doesn't look right, that looks grungy and not clean and not aseptic, then why would I want you now to put your hands in my mouth when I'm not really sure that you sterilized those instruments?
Oh,
And
absolutely.
you see a lot of assistants, again, short staffing. I understand that the pressures are on, and so they're trying to be really efficient about setting up treatment rooms. So they run in, they open up all the pouches, they unwrap the cassettes, and they leave everything out and potentially exposed to contaminants in the air as opposed to just opening them up in front of the patient. That is the best thing to do when they, in their minds, it's like, oh, I'm saving so much time. And I tell people all the time, take your phone or get a stopwatch and time yourself and see how long that really takes because your brain says, oh, yeah, I'm saving 5 minutes when it's really about 3 seconds that it takes to do those things. And I mentioned to you earlier that there seems to be this sense of complacency right now. And it started immediately after the COVID pandemic was declared over. People like, okay, let's just, back off to how we used to do things when maybe how we used to do things wasn't exactly the best way. So they've gone back on that. And I'm seeing more and more people walking around the office with their face masks under their noses, doing treatment. It makes me crazy to watch it on social media when people are going around with these face masks underneath their nose or under their chin, the face mask should be taken off when you leave the treatment room and thrown away because it needs to be changed after every patient. We don't put it back up on our face and reuse it on the next patient. And folks just kind of thinking, it's not a big deal. I keep sounding the alarm on measles. We've gone now in 2 weeks' time, according to the CDC, we have almost 100 more cases of measles. And if you are not screening patients for respiratory symptoms and you have especially little ones coming in that maybe aren't vaccinated and have been exposed, everybody in the practice can be exposed. And now we're heading into as the CDC used to call it, the triple demic season of flu, COVID, and RSV virus. And we got the holidays coming up and everybody's traveling and being around lots of people. We've got a lot of risks to us as healthcare workers and then to our patients as well. So we need to always be on our guard, always.
I cannot wait to be a part of the Rocky Mountain Dental Convention in 2026. We're going to be talking about the real state of dental assisting in 2026 in Denver on January 22nd and January 23rd. So I want you to be a part of this because dental assistants, we're going to bring you together in the Mile High City at the Rocky Mountain Dental Convention, and we're going to be talking about the things that are going well in the profession as well as the things that we can improve. It's going to be a great time of learning. I want to see you at the Rocky Mountain Dental Convention in Denver, January 22nd and January 23rd for real talk about the state of dental assisting in 2026. Join me and let's be real with each other. I'm really glad we're talking about this right now, not only because, as you said, we're heading into that time of year, the triple demic, as you like to say, but also we're heading into this time of year where we start planning ahead for 26 and what we should be doing better than we did in 25. And it feels like this is an area, especially with training and actually getting the right information, that we should be setting as a big resolution to head into the new year.
Absolutely, Kevin. I couldn't agree with you more that we need to have a definitive onboarding process for all team members, but for the clinical team, so they do get the right training, so they do get enough training, so they understand the whys and the hows of what they're doing. And yeah, let's do it better instead of saying, "Yeah, we're good enough." But are we good enough?
Right.
I keep hearing from practices. I had one team that was scheduled to do a virtual training with me last week. They're all sick. And it's like, okay, could it have been prevented? Maybe. But, employees shouldn't be showing up sick. And I get that that's a big problem when we're already short staffed. But there's nothing wrong with rescheduling a patient who has some severe respiratory symptoms because you don't want to all get sick. So, yeah, take a step back. The CDC has a fabulous checklist for infection control. That would be a great starting point for teams. Go through that, see what you're doing, what maybe you need to be doing better, or find out what you're not doing. And one of the things that we're still fighting that battle, even with all the information that's been out and social media and everywhere lately about water lines, I'm still running into so many practices that are not testing their water. And if you're not testing, you have no clue that whatever you're doing is working. And one of the things that's recently come to my attention is this issue of ultrasonic scalars, that many of them are plumbed into or connected to the dental unit. And so that water that goes into the ultrasonic unit is perhaps tested as part of an overall pooled sample from the unit. But if you tested your ultrasonic unit separately, it might not pass. And the reason is that the water goes through at lower pressure. So there's even more possibility or potential for biofilm to form. The last three offices I've gone into, every single one of the ultrasonic scalars failed a waterline test, but the rest of the unit was passing. So what you're doing with a pooled sample is you're kind of diluting everything, but you don't know if there's any one particular thing that's pushing you up above that 500 CFUs. And so what happens then with the contaminated water from the ultrasonic scalers? It gets aerosolized. And we've got people not wearing appropriate protection, and it's a bigger risk to the team actually than it is to the patient. So, yeah, we need to do it better. And so many practices will say, well, we're state of the art. We do everything we can to keep our patients safe. But are you really? Are you really? And why push back against, I have one client that will say to me, you know what? You always tell us the absolute right, correct thing to do. Okay. But,
And that's
we don't
bad?
have perfect. I'm like, I'm not asking you to be perfect, but won't you want to hold yourself out as this? We do our absolute best. Isn't that what you would want for yourself or your family? I guess I would.
I would. If I'm coming into a practice, I wanna know I'm safe, and my mom, my daughter, you, anybody that I love in my life, absolutely. So, last question for you, and we have so many new dental assistants and dental assisting students who listen to this podcast. I'm so appreciative of that. If they walk into a practice and it's kind of a, we don't really, let's do good enough mentality. How do they take the ownership to say we need to do better and maybe it's on me to try to raise that bar?
Mm, great question. And that's a courageous thing for a new dental assistant to do because as they're the new kid on the block, a lot of times, they will hear the famous words, we've always done it this
Oh yeah.
way.
Oh yeah.
I love that. It doesn't mean you did it right. And there's so much of this legacy training that goes on that we perpetuate the incorrect things. The best approach, I think, is to go to either the control coordinator, if there is one, or the OSHA coordinator, or the office manager, and say, help me understand. This is something that's very, very important to me. I want to make sure that I do my best, but I have some questions about why things are done the way they are, and always speak to it from their vantage point so that you don't put somebody on the defensive.
Yeah.
And maybe they can become the champion if they hear from the office manager or the control coordinator, I'm so busy, I can't deal with that right now. Then a courageous thing to do would be, how about I take that on? I would love to be the champion of this.
Mhm.
And that might make a difference, but they have to also be prepared for, the talk to the hand because maybe it isn't important. And if it really feels to that dental assistant or a hygienist, any team member, that it's not that important, then that's not the place for them to be. And there's plenty of other places to be where they want to do the best, not just settle for, it's okay.
I think there are different colors of red flags.
Mm.
Some are very light red, and it's like, okay, yeah, I can work with that. But this kind of thing, as you said, if I'm working in a practice, it seems like a huge red flag to me. And I have to think about, do I want to be associated with subpar standards whenever it comes to keeping people and ourselves safe as well?
Absolutely. In so many states now, we have dental assistants who are credentialed by their state. They can have disciplinary action taken against them if they're not following
Mm,
standards. So they need to keep that in mind. But do you want to really be associated with a practice that has mediocre at best infection control practices or other quality issues? Or do you really want to seek out the best? But again, we need to talk about it carefully, privately first and sort of test the waters and see. And I think anyone who has that private conversation with either their infection control manager or whatever, they can gauge what the reaction is. Oh, you're overreacting. Oh, that's not important. That is the biggest red flag right there.
yeah.
But if they say, you know what, I'm really stressed, I need help. Hey, let me volunteer. I would love to do that. And I think anyone in that kind of situation would be crazy not to say, yeah, help me. I really want to get this done. Yeah.
The Chicago Midwinter Meeting. It's one of the biggest meetings in the dental industry every year, and this year is going to be extra special because I'm going to be talking to dental assistants at the meeting, and I can't wait to be a part of it. So dental assistants and dental team members, join me Friday, February 20th, as we talk about harnessing the powers and personalities in the dental practice. Why can't we all just get along? We're going to talk about that. And then Saturday, February 21st, it's going to be extra special because dental assistants, this one's just for you as we talk about battling and beating the demons of dental assisting. So join me at the 2026 Chicago Midwinter Meeting. I can't wait to see you in the Windy City. Well, we're going to link to the Denver Post article that I first mentioned at the start of this. We're also going to link to that CDC checklist that Mary listed as well. Make sure that you have infection control and prevention information from the right people, the right sources, not just Facebook, not just your friends on TikTok, whatever it might be. So, but Mary is a great resource as well. And I want to make sure we have had Mary on countless times on this podcast. Go back into our archives, listen to some of the past things that Mary and I have talked about, and I know you're going to learn a lot. But Mary, tell people where they can also just get a hold of you right now or learn more about you if they want to reach out.
They can go to my website, marygovoni.com. They can email me at mary@marygovoni.com. And also, can we link the Association for Dental Safety, our beloved
Absolutely.
infection control organization? And one tool that they have that I think is great for dental assistants is the Ask ADS, a chat bot that is curated with trusted resources so you get correct information. Not so sure that you're going to get all the correct information from ChatGPT and some of the others, but Ask ADS is a great resource.
Yeah. And as Mary mentioned, ADS is something that unfortunately is a really well-kept secret sometimes in dentistry. And it needs to be not a secret because it's such a great resource and such great people behind the scenes working to make sure the right information gets to dental practices for their safety and their patients as well. So absolutely, please check the show notes. Lots of great links, lots of great resources in there for you. And Mary, as always, I appreciate you being that champion out there and bringing some things to our attention we need to really be thinking about every day.
Well, thank you for the opportunity, Kevin. I appreciate it.
Absolutely. And hey, thanks to all of you for listening to this episode of the Dental Assistant Nation podcast. We love to make sure dental assistants are educated, enlightened, informed, and that you're ready to take on the challenges to not only keep yourself safe, but your patients as well. So until next time, Kevin Henry, founder of Dental Assistant Nation, signing off, and as always, wish you nothing but success ahead.